All right, my name is Dr. Olayemi Sokumbi, and I'm a resident in the Department of Dermatology at the Mayo Clinic, Rochester. I'll be discussing our article entitled Vasculitis Associated with Tumor Necrosis Factor Alpha Inhibitors, which will be published in an upcoming issue of the Mayo Clinic Proceedings. Our study was a retrospective review from 1998 to 2011 of patients seen at the Mayo Clinic, Rochester, who had a diagnosis of vasculitis attributable to tumor necrosis factor alpha inhibitor use. We had a set criteria which included patients who developed the vasculitis while on TNF alpha inhibitor use, patients who had biopsies which confirmed the diagnosis, patients who had quiescence of their underlying diagnosis such as inflammatory bowel disease or rheumatoid arthritis, and patients who did not have any evidence of other more likely causes of vasculitis such as infection, malignancy, other medications, etc. We had 8 patients who fit the criteria set for the study, and over this period we reviewed the charts of the 8 patients. It was notable for cutaneous vasculitis occurring in about 63% of the cases. We had patients who developed systemic vasculitis involving the peripheral nerves in half of our patients, and 13% of them had renal involvement of their vasculitis. The common medications used were infliximab, etanercept, and adalimumab. Important to realize that we didn't have patients re-challenged with the use of the TNF alpha inhibitor use. However, we had 7 of the 8 patients who went into remission with discontinuation of the treatment. With the increased use of tumor necrosis factor alpha inhibitor use in clinical practice when taking care of patients with rheumatic diseases and systemic autoimmune diseases, it's important for clinicians to realize the paradoxical development of systemic or secondary autoimmune diseases while patients are on this therapy. Once they're aware of this, they can be able to clinically monitor their patients put on this therapy for this potential complication. For our patients, knowing that vasculitis can be caused by a variety of entities including infections, malignancies, underlying connective tissue diseases, and even medications, this data is important because we can now be aware that medications that they are on helping with other rheumatic or systemic autoimmune diseases may be responsible for their underlying vasculitis. And once we're aware of this, then we can take appropriate action such as discontinuing the medication and considering other therapies to help prevent this complication. As our study was a retrospective review, unfortunately we did not have any of our patients re-challenged with either the same or alternative tumor necrosis factor alpha inhibitor. The next step will be to really understand whether these patients are susceptible to the same complication of vasculitis development if they were challenged with the same medication or alternative medication in the drug class, such as a different tumor necrosis factor alpha inhibitor. Although the risk of systemic vasculitis is minimal, clinicians should be aware of and monitor for this potential complication when treating patients with tumor necrosis factor alpha inhibitors.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.